Good afternoon. I'm Katie Cottingham, and welcome to this news briefing from the 251st National Meeting and Exposition of the American Chemical Society in San Diego. We're joined today by Dr. Shanta Dhar and Bhabatosh Banik from the University of Georgia. They will be talking to us about a nanoparticle that can image and treat atherosclerosis. Dr. Dhar?
Hey, good afternoon. So today we will discuss about a nanoparticle which is synthetic yet biodegradable and which can detect and possibly treat atherosclerosis. Bhabatosh had a poster 2 days ago on this topic, and I'll just briefly describe this project. As we all know that heart disease is a dominant form of cardiovascular disease, and we are looking at different technologies, and one of them is really how to raise good cholesterol, or so-called high-density lipoprotein for heart diseases. But what recently we have seen that raising good cholesterol or high-density lipoprotein may not be very suitable for heart disease for several reasons. So we are looking at functionally mimicking high-density lipoprotein. So really looking at the activity of high-density lipoprotein, not structural mimic of good cholesterol. So what we have done, we created a synthetic nanoparticle which can possibly take cholesterol from macrophages which are present in the plaque and carry this cholesterol to the liver and inside the mitochondria of liver cells for intracellular cholesterol trafficking as well. At the same time, we aim to see this process by imaging, possibly by MRI. When these particles interact with macrophages, we want to look at the changes which happen at the cellular level. We have demonstrated therapeutic aspect of this technology by in mouse model of atherosclerosis, and we have looked at toxicity of these particles for a few weeks, and they're non-toxic. And we are looking forward for more more application of this technology.
Okay. Dr. Banik, do you have anything to add?
Yeah, that's most of it. The design was already there, like based on the high-density lipoprotein. And the reason, we have done two new modifications. One is macrophage targeting, and one is the MRI probe. So designing the MRI probe has recently been a little challenging, but we have figured it out. So we will be looking at how the macrophage targeting works. So once we put the macrophage targeting ligand onto the surface of the nanoparticle, we are going to see the real, what the MRI probe is going to do. Is it going to really differentiate between the plaques and the vulnerable plaques and the normal ones or not, and whether those MRI probe-loaded nanoparticle are also as effective as the previous formulations or not. So that's pretty much it, yeah.
Okay, great. So do we have questions? Please remember to state your name and affiliation when you're asking a question.
Hi, so it's Kath O'Driscoll from Chemistry and Industry magazine. Can you say a little bit about the contrast agent that you've used and how you've adapted it to include a sort of contrast chemical? What is that chemical?
We are using iron oxide-based contrast reagent. The problem is the core of these particles are very hydrophobic, and if we want to include a contrast agent, we need to have enough hydrophobicity of the contrast agent to be encapsulated inside the particles. So we modify iron oxide-based particles with a lipophilic ligand so that it has enough hydrophobicity to be incorporated inside. Also, this iron oxide, we want them to be smaller than usual because the way these particles are designed so that they can take up cholesterol in the core. So we want to have some space available for cholesterol to be uptaken. So I think there is a fine tune between how much of contrast agent we can put in, keeping some space available for cholesterol uptake. Do you want to add anything?
Yeah, I mean, that's a very good observation she already described. So we have seen that if we load in too much of the contrast agent in the core, so the cholesterol binding decreases. So that's an indirect proof that the incoming cholesterol goes and sits inside the hydrophobic core of the nanoparticles. So we cannot load in too much of the probe inside. Then that will prove to be a good MRI contrast agent, but that may not be as effective in taking up the cholesterol and removing it from the system.
And as a sort of a therapy, how would this be administered? How would these nanoparticles actually be used? Would they be used as a one-off treatment, or would you have to continuously use them?
Yeah, so we have been looking at intravenous injection, but we have not looked at other kind of formulation for other method of administration. The preliminary studies we have done, we administer twice a week, and what we have seen that initially it takes some time to show the therapeutic effect, and once it starts showing therapeutic effect, it's very good. We have to work more on administration, how many times we should administer, and whether you have some residual effect which you can use so that eventually you can reduce number of doses. We have not looked at that particular matter.
How much of the HDL nanoparticle is needed to actually achieve a therapeutic effect?
That's a very good question. We have looked at, I believe, 20 milligram per kilogram of the particles every week. Cumulative dose, and we have to still do a dose-dependent study. Now, it also depends on the model you are using. So we have looked at mice which are ApoE knockout, but on normal fat diet, and if we inject 20 milligram per kilogram cumulative every week, it shows therapeutic effect. On the other hand, if you take ApoE knockout animals but feed them with high-fat diet, then 20 milligram per kilogram if you put every week is not enough. You need to put more. So I think there is a lot more we can do. Initially, we did not increase the dose too much because we are not sure about the toxicity. Now that we know it has very safe profile, we can go higher.
How soon do you think before you can go to the clinic?
We would like to definitely know more, more in-depth mechanistic studies we have to do, because, as I mentioned, that these particles are not only designed to participate in extracellular cholesterol transport, they are also taking cholesterol to possibly the mitochondria of hepatocytes, and you are changing cholesterol metabolism pathway. You are producing a lot of sterol, and we would like to know in the downstream what those kind of alteration has effect before I think we can go to clinical trial.
Thank you.
Okay. Bela, did you have a question?
Bela Buslik, Office of Public Affairs. How does the size of these nanoparticles compare to with the contrasting agent included to the natural HDL nanoparticle? I presume they're aggregates of some sort, so they're not just single molecules floating around in space. So is there some kind of a difference in perhaps binding because of the size or the structure or the shape, or it's kind of an intriguing idea of using a diagnostic and the curative agent at the same time.
You want to answer that?
I guess your question is how is the size and what is the size and how is it correlating with the therapeutic effect, right? So, I mean, if you compare the size of our nanoparticles with the human HDL, it's actually quite big. Our nanoparticles are quite big. Those are 150 nanometers on an average size. So, but then there are several reports in literature that reports that the bigger the HDL nanoparticles, the more effective it is in clearing the lipids from the system. So we are actually hopeful that our system will work better in terms of removing lipid from the system. And I think the second part of your question is like putting in the MRI contrast agent into the nanoparticles. So that's why we are like tuning those iron oxide nanoparticles to be small enough so that we can accommodate more of the MRI contrast agent and leave more space for the incoming cholesterol as well. So like we need to tune that more so that we reach an optimum composition and that will show maximum lipid reduction as well as maximum MRI contrast.
Thank you.
Okay, there's a question in the back.
So the press release mentions that donor-derived HDL is problematic because of the immune response. And I was wondering, how do you design these nanoparticles so that a patient's body's immune system doesn't attack them as foreign?
Yeah, so these particles are completely synthetic. And so of course, being synthetic, it has less interaction with the immune system. And the size of these particles are designed in such a way that they have less interaction with the immune cells. And the peptide which we use as a HDL component, that's also synthetic peptide. And so they have less immunogenic effect.
Okay. If there are no other questions, then thank you very much for joining us. The archived version of this session will soon be posted at bit.ly/ACS Live San Diego. Please join us for our next press conference tomorrow at 9 a.m. on a National Academies report on effective chemistry communication. Thank you.
Thank you.
Thank you.